Welcome back. We're answering all your questions about the COVID vaccine with Cone Health's Chief Pharmacy Officer. Parent wrote in that their child is about to turn 12 in January, and they want to know, should I wait to give them the adult version when they turn 12 or give them the kids version when it's approved?
That's a great question, and I would go ahead and give them the vaccine as it was approved. So if it is approved before they turn 12, I would go ahead and get them that immunity as soon as possible.
And that is because you just want to protect kids and get it.
Exactly.
Someone wanted to know, my arm is still really sore after getting the shot. How long should that soreness last, and when should I start to worry that something's wrong?
Yeah, so we hear that sometimes from folks, and I've heard people who their arm has hurt for up to a week afterwards. If your arm is swollen, red, just so painful that you can't even touch it, and it's been more than a week, I would probably go see your doctor.
Someone wants to know, if I take the Pfizer booster now, do I have to stick with Pfizer for the rest of my life if we have to do this again, or will eventually they be interchangeable?
We don't know. We know that there are studies that are occurring right now around interchangeability, and so we just don't know that right yet.
Since the vaccine was originally developed for the first strain of coronavirus, how do we know that it protects against Delta and all the other variants?
And so the studies that we have seen that were done while Delta was out there, we know that it is protective. In the future, if we are not able to get the community immunity that we need, it is very possible that this virus will do what viruses always do, and they change and they replicate. And so that's why we're really working to get as many people vaccinated as quickly as we can so that the virus doesn't have another human host to go to.
You talked about community immunity. What is that level that we have to get to?
Yeah, so it depends on what you're looking at. There's not I can't give you a full number. We know that it is greater than 80% now. And so I can't give you a defined number, but it's somewhere between 80 to 95%.
Can people take the shingles shot and the COVID vaccine at the same time?
You can take them at the same time. Now, very interesting, the shingles shot also has actually a higher incidence of having more of those flu-like symptoms. And I personally was one who when I received my Shingrix shot, I got those flu-like symptoms, and I went back to get my second one because I would rather have those flu-like symptoms for less than 24 hours than the shingles.
Not stretch them out either. If you can do the COVID and the shingles at the same time, sounds great.
Yeah, any vaccine now you can get at the same time.
What do you think is the biggest myth about the vaccine that you've heard?
Oh, the biggest myth. There are so many of them. I don't know that I could actually say the biggest one. I know that there is concern still that the vaccine was created quickly and authorized quickly. And there were no steps that were skipped in the authorization and the studies of that vaccine. And now we have used that vaccine all the way since December in millions and millions of people throughout the world. And so we know the safety of it.
We had someone the other day email in that they've heard people have died from the COVID vaccine. Is that true?
There's a lot of misinformation that is out there, and I am not aware of anyone in our community who has died from getting the COVID-19 vaccine, and I'm not aware of anyone who has died from getting just the vaccine itself either.
So how safe is the vaccine then?
Well, it's very safe. side effects that folks get from it are typically very self-limiting. There are some very other rare side effects that might occur, some inflammation of the heart that also will alleviate over time. But they're very, very small percentages that occurs. We know that the Johnson & Johnson vaccine has been attributed to having some blood clotting problems. And again, it's a very small percentage when you look overall at the population.
Really quickly, what's your final pitch to someone who's still on the fence about getting a vaccine?
Oh, wow. Talk to someone that you trust that knows a lot about the vaccine and knows medical things. Trust the people that take care of you, and don't rely on social media to get your information. Talk to a medical professional that you trust.
Well, thank you so much for being here. A lot of great information. All of this will be up in the 2 Wants to Know section also of WFMYnews2.com.